Whenever clients present for treatment and help with pathological gambling, generally we ought to start with an assessment. An assessment really kind of just involves the integration of a lot of information from multiple sources. So for example, we can use self-report tests, data gathered from personal interviews, collateral information that can be gathered from medical records, employers, a spouse or a significant other, family members, and also if they've received prior treatment, we can contact, with their permission of course, and get information from a therapist or a physician. Generally, the purpose of assessment is to try to understand all of the variables and the factors that might be impacting this person's life and creating challenges for them. Certainly in terms of pathological gambling, we gravitate towards the financial issues and how that often creates a crisis for individuals that then needs to be addressed. But there are usually a lot of other issues that also need to be assessed and addressed as part of treatment. When we consider all of these factors, we have to take it into consideration that one of the most important things prior to any assessment work is to try to develop a good therapeutic relationship with a potential client. That's key. We know from a lot of the research from John Norcross, Mike Lambert, and others that over a decade or two of empirical studies have clearly demonstrated that Therapeutic Alliance and relationships account for a significant portion, up to 30 to 40% of positive outcomes in treatment. So we can't ignore that, and that starts when we first meet the client and really cultivating and working hard to develop a good relationship with them so we can build that trust as we work with them in treatment. We also want to collaboratively gather the information. It's certainly better to try to get their support and collaboration in getting the information that can help us understand their strengths and their limitations. That being said, we can also turn to other people that may be part of their support network with their permission, of course, and get information from them as well that could help us maybe understand a little more comprehensive picture of how a particular patient is doing. And then collectively, with all of the information that we gather as part of an assessment, we're going to use that information to help us develop a treatment plan and figure out what resources we ought to allocate to try to help this particular individual with the various challenges that they may be encountering. As part of our work with patients, we also can use whatever data we gather at time one with the baseline assessment as a marker, if you will, for how much they have changed after we have treated them or throughout treatment. So in other words, let's say, for example, we administered a little self-report measure on gambling behaviors at intake. We could use that periodically throughout treatment to determine whether or not they were improving in that particular domain as a result of the energy and effort that we were putting into working with them. And as a result, we use assessment not only to understand what resources could be allocated at the outset of treatment, but also across treatment and then at termination. And subsequently, assessments are really, really crucial and important part. It's the very first thing that we often do when we meet with pathological gamblers.